Hi guys, my name is Jacqueline Figaro and I'm an occupational therapy student. Today I'm going to be arguing for healthcare professionals addressing social determinants of health that are known as well as that are suspected to be influencing patient health. First, what are social determinants of health? They are factors that influence health status such as income, social support, early childhood development, education, employment, housing, and gender. Income or social status is known to be a social determinant of health as higher income is linked to better health. The larger the disparity between rich and poor, the greater the health differential. Social support is important as family, friends, and community support is linked to better health. Another example is education. Lower education is linked to poor health, more stress, and lower self-confidence. Employment is a social determinant of health as people that are employed are healthier, particularly those who are in control of their working conditions. One of the most important social determinants of health is housing. The physical environment includes not only a safe house, but also clean air, safe water, a healthy workplace, safe community, and safe roads. Social determinants of health are the conditions in which people are born, grow, work, live, and age. They include economic policies, development agendas, social norms, social policies, political systems, etc. This is why they are referred to as a wider set of forces and systems shaping the conditions of daily life. Why is addressing social determinants of health controversial? Healthcare clinicians are faced with various patients that have unmet social and economic needs. These needs serve as a barrier to adherence, limit treatment planning, and may shape the flow of the entire clinical interaction. Healthcare professionals are in agreement that these are important. However, they do not believe that they have the time to address them. Physicians believe that there are other resources they can access to meet these needs. Physician burnout was also an important topic in this debate. To avoid this burnout, physicians need support from other healthcare professionals such as social workers in order to address these issues. Impacts of social determinants of health. As stated before, I am arguing pro addressing social determinants of health that are known as well as those that are suspected. This is because the impacts they have on the patient play a role in their health status and impact their perception of well-being as well as their right to access equal health care. As a future clinician, it is vital to advocate for patients to have equal health rights and provide access to resources to support these needs. Addressing social determinants of health is a right for patients and is critical to establishing a treatment plan that is accessible, as well as for developing rapport and empathy. Addressing social determinants of health is not only important for improving overall health, but also for reducing health disparities that are often rooted in social and economic disadvantages. Research has found that health behaviors such as smoking, diet, and exercise are the most important determinants of premature death. Evidence also found that stress negatively affects health across the lifespan. Healthy People 2020 is a federal government prevention agenda created to build a healthier nation. This national health objective was created to identify significant threats to health and to establish goals in order to reduce these threats. The goals of Healthy People 2020 are to attain higher quality, longer lives free of preventable disease, disability, injury, and premature death, achieve health equity, eliminate disparities, and improve the health of all groups, create social and physical environments that promote good health for all, and promote quality of life, healthy development, and healthy behaviors across all life stages. Federal initiatives. The Affordable Care Act was established in 2010 and extended coverage to more than 27 million Americans, reduced the uninsured rate, and allowed healthcare systems the ability to focus on social determinants of health. This act also shifted payment methods, allowing health systems, public health departments, and other stakeholders the ability to focus additional resources and creativity on addressing the social determinants of health rather than filling gaps in coverage. This allowed healthcare professionals to move beyond disease management as the sole focus of their population health improvement efforts. The Center for Medicare and Medicaid Innovation established the Accountable Health Communities model. This was developed specifically to test approaches to integrating health and social services. To date, 31 accountable health community demonstration sites have been funded. Each must screen and address a core set of 5 social needs: housing instability, food insecurity, transportation needs, utility assistance, and domestic violence. Healthcare role in addressing social determinants of health. Social prescribing is implementing social determinants of health interventions. These interventions include several core elements: screening patients for unmet social needs, connecting patients who screen positive to a community health worker, referral of the patient to community-based resources or public programs, and support for and tracking to ensure resolution of this need. Another intervention includes hotspotting. This is known as identifying geographic clusters of patients with high levels of healthcare utilization as well as the economic factors that are involved. In conclusion, social determinants of health are a priority for healthcare professionals to address when treating patients as they influence health and well-being. Addressing these factors can prevent health disparities and diseases. Improving the conditions in which people are born, live, work, and age will ensure a healthier population, thereby improving national productivity, security, and prosperity through a healthier workforce. This is why healthcare professionals should address social determinants of health that are known as well as those that they feel may be impacting patient health.